Presley back with another video on my leg workout, so let's get into it with some squats. 1, 2, my arm hurts. I think I need to stop the video.
In the TRX building of Galileo. Can I ask for a EMT crew to hurry up?
All right, ready? 3. Grab the blood pressure code. Yeah, can you hear me? Can you hear me? Good pulse. Can you check her heart rate?
Responsive.
Alright, today we're very faint. We'll see if we can feel us anywhere.
In this scene, Misha and Kaley perform scene size up. Scene size up is important to find scene safety and NOI or MOI. In this case, the NOI is a heart attack. You may have also noticed that Misha and Kaley discovered that the patient was unconscious. Level of consciousness is important to give insight on whether the patient has brain damage or their mental status.
2, 3. Okay, let's get her out. This is Medic 39, making your radio report at Galileo High School on Bay and Van Ness. Destination is to SF General Hospital with an ETA of about 10 minutes. Patient is female, 16 years old, unconscious currently, with a chief complaint of chest pain and unknown present history of any medications or allergies.
Alright, 60 beats per minute. Checking breathing sounds. Breathing rate is 12 breaths per minute. Heart sounds normal, lungs sound normal. Invisible decapitations to the head and part of the body. So most likely a myocardial infarction.
Misha just began his initial assessment. This started off with CAB, which means checking if the patient has circulation, airway, and breathing. Misha also just determined if the patient was big sick or little sick. This means the difference between fighting off common cold versus fighting off something like a myocardial infarction. If a patient is big sick, they have to go to the ER immediately.
Pupils are normal. Checking vital signs. Pulse is going to be 60 beats per minute. Checking breathing. Going to have 5 breaths per minute. Going to check her heart sounds and lung sounds. Heart and lung sounds sound normal. Heart is a little bit slower though. We'll be checking her pupils. Pupils are normal. We'll be checking her blood pressure now.
can see, Misha continues to check up on the patient's vital signs throughout the ambulance ride. Vital signs include pulse, blood pressure, breathing rate, skin signs, pupils, and mental status.
Unknown prior medical history and unknown allergies and medications. Current EMT response and treatment is pumping oxygen through the treatment in a non-rebreather mask. Thank you, that's it.
Right now, the EMTs are in the period of the golden hour. The golden hour is a period of time immediately after a traumatic injury to the point where the patient is at the hospital. The golden hour is important to keep track of because it is a time of frame in which death can be prevented. In this part of the video, Misha is checking for DCAP-BTLS. This stands for deformations, contusions, abrasions, punctures, burning, tenderness, lacerations, and swelling. DCAP-BTLS is important because it helps you look for injuries that may be life-threatening to a patient after a traumatic injury.